All right, welcome to The Explainer. Today, we are diving deep into something that affects literally millions of people in the UK, the official cholesterol guidelines. These rules can have a massive impact on your health, so let's just get right into it.
So, let's kick things off with the big one, the question that really got everybody talking. Back in 2014, there was this huge rule change, and suddenly, millions more people, especially if you were over 60, were told they might need statins. The big question is, why? What happened?
And yeah, that leads us straight into our first section, the great statin debate. Look, this wasn't just some small adjustment. No way. It was a complete shift in thinking, and it got a lot of people worried. Were we about to start over-medicalizing perfectly healthy folks? All because one number, the official cutoff for treatment, was dropped.
Okay, so it really all comes down to this, doesn't it? How do your doctors actually work out who's at high risk? It's not just a hunch. There's a really specific, step-by-step process they have to follow.
The whole thing kicks off with casting a really wide net. The idea is to systematically check pretty much everyone over the age of 40 for their risk of cardiovascular disease. You'll hear that called CVD. This is the ground floor, the starting point for millions of those routine health checks that happen all over the country.
So, this risk assessment, it follows a pretty clear three-step playbook. First, they identify everyone between 40 and 84. Then, they use this special calculator. It's called the QISC-2 assessment tool. And here's the really important part. It's not just about your total cholesterol number. The calculator needs both your total and your HDL cholesterol. That's the so-called good cholesterol to get the full picture of what's going on.
Now, it's really important to note that this QRISK tool isn't a one-size-fits-all thing. If you have certain conditions, say type 1 diabetes, or a serious kidney disease, or a genetic thing called familial hyperlipidaemia, well, you're in a completely different boat. You've got your own set of guidelines. And it's also not used for anyone 85 or older because at that point, age itself is considered the main risk factor.
Okay, let's just quickly touch on that genetic disorder I mentioned, familial hypercholesterolemia. It's a bit of a mouthful, but what it means is your body is genetically wired to have super high cholesterol right from a young age. So doctors are really on the lookout for two big red flags. A total cholesterol level over 7.5, or if you have a family history of heart disease showing up really early, like before age 60.
All right, now we're getting to the absolute core of it. This is the heart of that 2014 change. We're about to reveal the one little number that caused all that debate and basically changed the game for preventative medicine here in the UK.
So what was the big headline? It was all about lowering the bar. They dropped the risk cutoff. Before 2014, that number was higher, but the new guidelines, they introduced a new, much more sensitive trigger point for when doctors should start talking about treatment.
And that number is 10%. Just 10%. So what does that mean? It means if your calculated risk of having a cardiovascular event, we're talking a heart attack or a stroke, in the next 10 years is 10% or higher, boom, you've officially crossed that new threshold.
And here's the official wording, right from the source. The key word to pay attention to here is offer. See, it's a recommendation, a very strong one, but it's not a command. It's not mandatory. This 10% score is the starting pistol for a serious conversation between you and your doctor about whether medication is the right move.
Okay, so what happens then? Let's say your risk is over 10%, and you and your doctor decide medication is the way to go. What does that treatment plan actually look like in practice?
Well, it really depends on your medical history. There are two main paths. The first is called primary prevention. This is for people who have never had a heart attack or a stroke. For them, the usual starting point is atorvastatin 20 milligrams. But then there's secondary prevention. This is for people who already have cardiovascular disease. For them, the approach is way more aggressive. They start right off with a high-dose atorvastatin 80 milligrams.
And hey, remember those groups we talked about earlier? The ones who don't use the QRISC-2 calculator? Well, they have their own specific rules. So for adults with type 1 diabetes, doctors will consider a 20 milligram dose for basically everyone, but especially if they're over 40. And for people with chronic kidney disease, that same 20 milligram dose is pretty much the standard starting point.
Now, taking a statin isn't something you just do once and forget about. Think of it as the beginning of a journey. 3 months after you start, you'll get your cholesterol checked again to see if it's working. If you haven't hit the target, then it's back to the drawing board to talk about lifestyle and, maybe increasing the dose.
So what is that target they're aiming for? It's a big one. A drop of more than 40% in your non-HDL cholesterol. That specific measurement is the key indicator doctors are watching. It tells them if the statin is doing its job. It's a really clear, measurable goal.
But, and this is a huge but, the guidelines are crystal clear about this.
the pills are not the whole story. Not even close. A prescription is meant to be a partner to major lifestyle changes, not a replacement for them.
And when it comes to diet, the guidelines get super specific. They recommend what's called a cardioprotective diet, and they give you actual numbers to aim for. The big goal is to get your total fat intake down to 30% or less of your daily calories. And, even more importantly, to slash your saturated fat intake to just 7%.
So, what does that actually look like on your plate? Honestly, it's the advice we've all heard a million times, but the difference is, here it's official guidance. We're talking at least 5 portions of fruit and veg, oily fish, nuts, whole grains, all while cutting way back on sugar and swapping out things like butter for healthier oils like olive or rapeseed oil. And it's not just about food, right? The guidelines cover the whole lifestyle package. For exercise, the goal is at least 150 minutes of moderate activity, like a brisk walk, or 75 minutes of something more vigorous, plus strength training twice a week. They also say to keep alcohol to no more than 14 units a week. And for smokers, the advice is simple and direct. Get help to quit.
So after going through all of that, from the risk scores and the pills to diet and exercise, it kind of leaves us with one big question, doesn't it? Are these guidelines really just about a number, a 10% trigger to write a prescription? Or are they actually designed to be the start of a much bigger, much more important conversation about your health as a whole? Definitely something to chew on. Thanks for joining me.